Hi friends, welcome back. This is Kara. I'm here with the People's Harm Reduction Alliance and a co-founder of the Harm Reduction Doula Collective. And I'm going to talk a little bit more about what other interventions may be provided. I already talked about the cascade of interventions, but that was not an exhaustive list, and neither is this, but it's a little bit deeper into what other interventions may be offered. And so let's get started. So some of the other interventions fall under the category of assisted delivery. So if you are laboring and we are at a stage where baby is trying to exit the body, but is needing a little bit of extra assistance or is getting a little bit stuck, a provider might try to manually go in and spin baby, twist baby to get baby in a better position. That is your choice, whether or not you would like that to take place. They may also offer vacuum assistance, which is when they apply suction to the top of baby's head to help pull baby through. Forceps aren't really used as often, but forceps were used as a way of clamping baby's head and helping to assist through. Some reasons why people may not want to do that is one, the potential for introducing bacteria or any sort of infection potential into the birth canal through a foreign object, or the potential for tearing. So when we start to move through labor at a faster pace, sometimes our bodies aren't quite ready to adjust to that sudden movement. Hopefully they would be working with contractions and the motion of natural contractions to in combination with this intervention to move baby out incrementally, but sometimes it's not. The reason somebody may choose to is because it can be really helpful. You might be feeling fatigued, you might need a little bit more assistance, and it may be a preventative measure to moving to a C-section. So if they're like, hey, you know, we are so close, but we're just not seeing progress, and we need to get baby out, like there might be some signs of distress that aren't like yet a 911 emergency, but we're thinking that these are some of the last interventions that we want to try before we move to the point of a C-section. Would you be open to that? That could be a way that this is introduced into the birth space as an intervention. I talked about tearing. So something that may be offered to you in this scenario as well is an episiotomy. And the episiotomy is when they cut the tissue or the perineum surrounding the vagina, the vaginal opening, to make more space. It is completely up to you. But the overwhelmingly recommended guidance from people who have received them, from providers, from the research that I've consulted and the trainings that I've attended, and the providers and pelvic floor PTs that I follow on Instagram and consult. My overwhelming knowledge about this subject says just say no to episiotomies, and here's why. Our bodies will naturally tear in the path of least resistance. Our bodies contain a cellular knowledge. They know how to break and repair. When we like manually come in and we cut, we make a linear cut or a diagonal cut. We are cutting through ligaments, we're cutting through nerve endings, we're creating a wound that's going to be harder to heal because our body didn't make that wound to heal it. And it's a less natural course of tissue tearing and healing. And when we create that, we can create oftentimes scar tissue. When we create scar tissue or more intense scar tissue, that scar tissue can harden and cause complications later on. Whether that is incontinence, whether that is painful sex or passing urine, pooping. These are all concerns we might have with healing an episiotomy. After birth, let me rewind. They may also offer you a like vaginal massage. Again, like I mentioned like I'm about to mention with fundal massages, we use this term massage in labor and delivery in very loose terms. These are not pleasurable. When they talk about a perineal massage or a vaginal massage, they're oftentimes talking about inserting a provider's fingers and tugging at the opening of the birth canal in order to try to manually stretch it out and make more space. Again, that can increase tearing potential. It can cause bruising or discomfort, and just make healing more painful. So it is up to you whether or not you feel comfortable or want to receive that intervention. You can always say no. And if somebody violates that, that is obstetric violence. So after you give birth, they will need to detach. They will be encouraging the detachment and birth of the placenta. The placenta should have already detached in the progression of labor. We'll talk about some complications that can happen with placentas in another video, but they will be checking you for bleeding, for hemorrhage and clotting by doing a fundal massage. You can ask them to you can let them know if it's causing you a lot of pain, but it's putting pressure on the top of the uterus, pushing down to try to measure the amount of blood that is being released from the uterus, and also to encourage the placenta to be birthed out as well. They may also try to tug at the umbilical cord that is attached to the placenta in order to try to encourage the placenta to leave the uterus and be passed through the cervix and the vaginal canal. If this is causing you a lot of pain and you need space and time, or you want to try to allow the contractions that are naturally occurring to birth the placenta yourself, it's okay for you to vocalize that and to ask for that. It's also okay to refer back to that BRAIN acronym. What are the benefits? What are the risks? What are the alternatives? What is the information and your intuition telling you? And what happens if you do nothing? Those are all options that are available to you. So when baby is birthed out and when the placenta is birthed out, they will cord clamp the cord leading to your baby so that they can cut the umbilical cord. Some people elect to delay cord clamping or like to leave baby attached to the placenta. It's sometimes a cultural thing, sometimes a personal preference. That is an organ that has supported your baby through gestation and provided with a lot of nutrients and oxygenated blood. So leaving the umbilical cord attached to the baby and the placenta is sometimes believed to help support more oxygenated blood going to the baby's system and kind of support their breathing process. When baby enters the world, they're learning to literally breathe on their own because you've been providing them oxygen through your placenta and your bloodstream, and they haven't had to practice their breathing reflex. Those are just a couple of the reasons. It's not exhaustive, and that's like completely up to you. The other interventions that you'll see them do with baby or tell you about and offer is nasal aspiration is when they take the little squeeze bulb and suction out any of the vaginal fluids, or sometimes like meconium if baby has pooped during the labor and delivery process. They want to make sure that baby doesn't aspirate any of that poop and causing an infection or any complications. So they'll kind of like squeegee it out. It can also just help open up the airways so that baby can breathe. A reason why somebody may not want that to happen to their child is just, I mean, there's pretty minimal risk, but it's just kind of uncomfortable to like, I think for anyone to like enter a room full of people, even if you're an infant, and have something shoved up your nose. But the risk is really low, and there are a lot of benefits that are very like well documented, fair and valid. Vitamin K injection or oral supplement is to help stop any bleeding. Babies are born vitamin K deficient. So this is just like a little added boost to support them. The reasons people might say no to it is because they want to, or they don't want baby having an unnecessary amount of like needle sticks right out the gate. And if the oral supplement isn't available, erythromycin is an antibiotic that they often give baby that prevents infections, eye infections caused by STIs. So this can be really important. It's also again completely up to you. Although sometimes in prenatal care we may test for STIs, the potential for getting reinfected is still there. Sometimes we don't get tested, or sometimes STIs don't present symptoms. And sometimes STIs can cause infections in baby, especially eye infections. So having that dose of erythromycin can minimize that risk. But if you feel confident that like you don't have any STIs, or you don't want your baby to receive antibiotics, you are the guardian, you are the like legal caregiver of that infant, and you get to make that decision. Hep B vaccine. So hepatitis B is passed through blood and can also be passed on to baby through vaginal delivery. This is a really early intervention. So once people get Hep B, it is able to be managed through medication, but it's not curable. So much like you may have been offered, especially if you're an injection drug user, or if you've ever been incarcerated, like I have, or you have been living unsheltered, they may offer you or ask you if you have a hepatitis B vaccine. And the reason being because you may be at increased risk of being exposed to the bloodborne pathogen, this disease, through exposure to other people's blood. And hepatitis B is like a pretty hardy virus, so it can survive and is like quite potent. So receiving the hepatitis B vaccine early can be a way of minimizing risk, but it is your decision whether or not you want a baby to be vaccinated. We're also just going to talk really quickly about the APGAR score. So when they move baby over, they take baby's weight, height, time of birth. They're also going to be performing a series of tests called the APGAR, and it's the numbers that you kind of want to pay attention to. Well, the number that you want to pay attention to is a 7. So above a 7 is in good health. Below a 7 means that baby might need some extra medical attention. So the lower the number, the more critical. So baby may be moved to the NICU, which I have a couple different videos that I've made about the NICU and what to expect with the NICU. Oftentimes you may be moved to the NICU and not have a long-term NICU stay or a very short one while they just kind of perform more tests and monitor. So it's important to stay like grounded in that and just understand that this scoring system is really just meant to assess the health of baby and to make sure that they aren't missing anything and they're doing their due diligence on whether or not baby's healthy. If it's above a 7, then you're likely going to get transferred directly to a postpartum wing where you can start your postpartum journey with baby. The last thing I'm going to mention, because this is super important, and I leave this last because I want to make sure that it's talked about, is if you are a parent who has a history of substance use or is in active use when you give birth, when they move baby over to the area of labor and the area of the labor and delivery room where they're performing those tests and they're weighing baby and they're kind of asking you about all those interventions, it is very common for them to put a little plastic shield over baby's genitals in order to try to catch the first pee. And that is so that they can perform a drug test on baby. You have the right to refuse that test. They more likely than not will not tell you that you have that right. And you can ask them, what is this for? Is this to collect a urine sample from my baby? Are you trying to detox my baby? And you can just say, I do not consent to that. If you don't, they will probably bring up that they're just trying to rule out any complication, provide the best care to your baby. And again, it's always up to you. You can ask them, you know, what happens if I don't consent? How urgent is this? What if I just say no? Or you can say, what is the APGAR score? Are you seeing anything that you're concerned about? I don't consent to this and I would like you to take this off my baby, and I would like to wait and monitor baby in postpartum to see if there are any concerns that are arising like you would with any other baby. They don't just put these pee catchers on anyone's child. They wait to see if there are symptoms of concern that create a medical necessity. So if it is not medically necessary, if there's no reason to be concerned other than to just collect data, to collect information on your use, or whether or not a baby was ever exposed to to substances in utero while they were inside of your body, that's not medically necessary, and you can say no. Even if they say it's hospital policy, you actually, I will mention this in the Know Your Rights training, There's a Supreme Court precedent in Charleston v. City of Ferguson that says that you have the right to refuse to be eutoxed, and you also have the right to decide what care is provided to your baby. If they eutox you without your consent, that's a violation of the Fourth Amendment search and seizure. And their hospital policies do not trump the Constitution. You can tell them if they have a problem with it that they can document it in their chart. You can even ask for a new nurse if they don't respect your rights, because you are a person with human rights, regardless of whether you use drugs and regardless of whether you become a parent. I really hope that this was helpful. Last little tidbit, they can also test the umbilical cord and baby's first poop. So some ways that you can facilitate care around that intervention is getting up and changing baby's diaper before they have the opportunity to take it, and letting them know that they don't have the right to test or the placenta. Sometimes people keep their placenta, so if you want to keep your placenta, that's your placenta. You grew that organ, that's your placenta. You can have it buried, you can look into whatever ritual you want around it, or you can just simply ask them to dispose of it, but that is your right, and that's what I will leave this video of interventions on. Let me know if you have any further questions in the comments or the through a direct chat with me. As always, love you all, and I hope to see you in in-person workshops and in future videos. Thanks, bye.